Ectopic pregnancy is the implantation of the fertilized egg outside the cavity of the uterus, i.e. outside the endometrium lining the uterine cavity. An ectopic pregnancy can be located in many different places, including in one of the fallopian tubes, in an ovary, on the cervix and in the abdomen. Most often, it implants in a fallopian tube or fallopian tube. Symptoms of ectopic pregnancy. The first signs of ectopic pregnancy are late period, like any pregnancy, pain in the lower abdomen, often on one side, often dull with more intense attacks. These pains are sometimes absent, scanty vaginal bleeding of a blackish color. In the presence of these symptoms, consult very quickly because the danger, in the absence of early treatment, is the occurrence of a rupture of the uterine tube with internal intraperitoneal bleeding. The exact causes of ectopic pregnancy are not always found, but we can however cite a few risk factors: smoking, repeated curettage, various sexually transmitted diseases, advanced age of the woman, etc. If the patient has already had an ectopic pregnancy, the risks of a new episode are higher. Diagnosis of ectopic pregnancy. An emergency. The diagnosis is confirmed by 2 urgent examinations, an abdominopelvic ultrasound by endovaginal route. It shows that the cavity of the uterus is empty and that there is a mass at the level of a fallopian tube, a blood test of the beta-HCG hormone whose level is high, a sign of an ongoing pregnancy. Medical treatment. In the case of an early ectopic pregnancy that has not yet ruptured, it is possible to use a dose of methotrexate, given by injection, instead of surgery. This drug induces the shrinkage of the ectopic pregnancy and its disappearance. Surgical treatment. In the majority of cases, laparoscopy allows the egg to be fully implanted in the fallopian tube to be removed. To do this, a thin tube with a camera is inserted through a small incision made in the abdomen. The egg and the blood are thus aspirated,